It's HealthView on your talk station, News Talk 640 WFNZ.
And welcome back to HealthView. This is Dr. Angela Ruff, and again, our guest this morning is Raleigh Neurosurgeon, Dr. Kenneth Rich with Capital Neurosurgery. And if you have questions for Dr. Rich later on, their office number is 919-850-9911. Again, that's 919-850-9911. So before the break, we were talking a little bit about this study that your office is involved with. And so for patients that instead of having a cervical fusion of the vertebra to the disc, did I say it right?
Well, vertebra to vertebra, eliminating the moving disc.
Okay. Instead of that, they could actually have a disc replacement with this new device which you're doing the study on, which is not as yet available for the general public. But maybe if you wouldn't mind just kind of elaborating a little bit about this Neo disc.
Okay, well, one of my famous quotes was, "It's squishy," and I took a lot of kidding for that.
Right.
We had our first patient who got operated on. One of our first patients was covered by the News and Observer, and he ended up on the front of the Sunday morning paper. And somewhere in that article, I described the disc as being "it's squishy." And my wife and everybody said, "You went to school how long
to learn these
squishy
big
was
words.
The best you could do?"
But everybody can understand that.
That's what I said. I said I could have said pliable, but everybody understands squishy.
Yeah,
okay,
that's a good word.
Cartilage is the same thing as gristle and meat. Okay, when you bite into gristle and meat, it's squishy.
It's squishy. That's right.
Well, cartilage is the same thing. It's got a nice elastic kind of quality to it. It absorbs shock. It moves. This is a squishy product. It's got a silicon wafer in the middle, and we all hear silicon and go, "Oh, my God, remember the silicon breast implant thing?"
Right. And they're approved again for the FDA.
That Dow Corning went down, paid $3 billion to settle that case. It was totally without any merit.
I know, crazy.
Silicon is a very safe thing to put in people. It's been put in people for 50 years.
Right.
Polyester is the other thing that this disc is made of.
No kidding.
It's silicon and polyester, and both of them have been put in people for over 50 years. So we have a very safe, biocompatible thing. It's nice and elastic like your disc. From a surgeon standpoint, it's relatively easy to put in. That's very important, because the more technically demanding you make something, the more likely somebody is to use it wrong.
Right.
And we all like to think, "Oh, gosh, I'm a good surgeon," this and that. Well, I'm human.
Yeah.
And if you make it harder, I'm going to have more complications. If you make it easier, I'm going to have less. This is very easy. So what we do is these patients, as I was saying when we had our commercial break, they're randomized. That's the FDA's rule, and you follow the FDA's rules in these studies. And they go to sleep not knowing what they're going to get, either a fusion or a disc.
Do y'all flip a coin?
No, a computer decides, and
the computer
guess
decides.
What?
Wow.
I don't know what they're getting either.
Wow. Huh.
So because the first hour of the operation is the same, we literally open an envelope in the operating room. Little a la Johnny Carson, I think. But we open it, and it comes out either treatment group, which gets a disc replacement, or control group, which gets a fusion, and that's what we do.
Wow. Huh.
So that keeps us all from prejudicing anyone about their results.
You can't accept
surgery.
bribes then.
Right. We just, that way everybody goes into their surgery with the same mental set.
Sure. So they can only get mad at the computer.
I hope so. But anyway, then we do the surgery, and we've had some excellent results with both groups. Again, the fusion operation is a good operation. We're just trying to make it better.
Right.
But we're so far very blessed that both groups are doing very well, and we're very pleased with how our outcomes are coming along. I saw a gentleman actually this morning. This is a taped interview, so this is actually not Saturday morning. But this morning in my office...
You don't want people calling you asking for Saturday hours, huh?
Yeah, don't call Monday through
Your
Friday
wife
9 to 5
happy.
because my partner's on call this weekend and he doesn't want to get
I won't give your cell number out, just your office number.
But I saw him today. He's a year out from his surgery. He has a neodisc in, a disc replacement. He has one of the most physical jobs you would ever want. This man... People go into the woods and cut down trees for lumber. And he goes in and hooks this big tractor up to them and hauls them out of there.
Wow. He's doing that now after your surgery?
He is doing that. He's been doing it since, I think about 3 or 4 weeks post-op.
Wow.
And he's taken no pain medicine. He's doing great.
That's awesome.
He really is.
Yeah.
Now, does that mean everybody who has an operation does like that? No, it doesn't. But it's an example of how durable these discs are and how well these patients can do.
Right. So, lumberjack poster child for the NeoDisc.
Yes, I think we could make him our poster child. But we have other people who are doing well also.
Yeah. Well, that's really terrific. That's great, and I'm sure he feels like you gave him his life back.
Well, he's very happy. He told me that he had a friend that he was going to send to see me. So that word, if someone will send you one of their friends or relatives after you've operated on them, they got a good result.
Yeah, absolutely.
Or they don't like their friend or relative, one of the two.
That's right. Now, if you start getting a bunch of mother-in-laws referred to you, we're going to start to wonder. Although I like my mother-in-law.
I get along with mine, too, so that would break down there. The other nice thing about this study is we follow the patients so much longer, which in a way is a bit of a pain to them. They have to come to my appointment and this and that. Normally we'll follow a disc surgery patient, whether it's lumbar or cervical, about 2 or 3 months. But we have to follow these patients 2 years after the last patient is entered into the study.
Wow.
Which for some of them could be 3 or almost maybe 4 years, depending on how long the study goes. They're close to closing out the study. We think within the next few months we'll have all 488 patients that the FDA said we had to enter into the study. There's 24 sites around the country doing this. So we think we're going to hit 488, and then we'll be able to close enrollment. So if you want a neodisc, you have to actually
better call soon.
Pardon me?
If they want to be a part of the study, they need to call soon, then.
Yes, it probably only has a couple more months to go. 2 or 3 more months would be my guess. Now, we don't know what the other centers are doing. We get a monthly report about how many patients and what center has this many and that many. But day to day, we don't know what the other centers are doing. There's 24 of them around the country, so. But we're over 400 of the 488. We know that. Right.
Well, that's terrific. Now, there's some other procedures that you guys do as well. So, and how about maybe if you could talk a little bit about if somebody has nerve problems with their hand or leg. I mean, is all the surgery, is it done on the spinal cord to correct, or do you go to other parts?
Well, we operate on different parts. Of course, people refer to us as brain surgeons, not because that's the most common thing that we do. Actually, spine surgery is the most common thing we'll do, but because it's the most glamorous, it's the most attention-getting. And we cover Wake Med's Trauma Center along with our colleagues at Raleigh Neurosurgery. And sometimes you'll see some very sad things there, head injuries that people get hit by cars, or they fall off a ladder or fall, they're at a construction site and they fall through a partially laid down floor or something, and they'll get a head injury. Sometimes we have to operate on those, sometimes we don't. We treat brain tumors and types of brain hemorrhages, blood clots on the brain, those sorts of things. We also operate out more in the arms and legs, particularly in the arms. We might do carpal tunnel surgery for people who have a annoying tingling and numbness that wakes them up 5, 6, 7 times a night. in their hands and forearms.
How is that? What do you do surgery in the wrist portion for that carpal tunnel, or
carpal tunnel is treated by surgery in the wrist? Yes, it's a very annoying problem because every time you wake up, you don't go immediately back into a deep sleep.
Mm-hmm.
It takes time to get down into those real deep sleeps that really refresh us. So you wake up, you shake your hand for 5 minutes, the numbness goes away,
mm-hmm.
and then you go back to sleep. But for 30 minutes, you're not getting good sleep.
Right.
And then you get good sleep for 30 minutes, and then you wake up again with your hand tingling. And it gets so disruptive of their good rest that a lot of people, most people with carpal tunnel, actually opt to have it treated surgically.
Mm-hmm. Right. Actually, when I was a resident, I had ended up having that surgery, and I was having restless nights, probably because I was thinking I'll never be able to practice dentistry.
Well, people who use their hands a lot, surgeons too. I mean, I get a twinge of carpal tunnel every now and then.
Uh-huh.
People who do a lot of repetitive movement, transcriptionists. When I was back in medical school, and again, we're getting into this, I'm dating myself, it was jackhammer operators. But now that we have mechanical devices that do the jackhammering to break up road concrete and things, we don't see that.
Right.
But repetitive movements, dentists use their hands, car mechanics use their hands. I mean, you're just an oral mechanic.
Yeah.
I'm a body mechanic. Car mechanics are car mechanics. We all use our hands repetitively.
Right.
Transcriptionists do the same thing. People on computers a lot do the same thing. So they tend to get a little pressure on that median nerve in their wrist, and that's a very successful thing to go in and just let the pressure off and get something.
Yeah, it was a pretty easy procedure, so I was happy to have it done, and I was working within a week. So,
that's very, very important to get people back to normal function, and you're a good example of somebody who had a surgery and got back the use of their hands so they could pursue their career.
Yeah. So, I had to pay off that college loan. I was really motivated.
There's why you do it.
That's right. But, well, that's neat. Well, certainly you do have a glamorous job, with being a neurosurgeon and being able to help so many people and with varying degrees of needs. And I really appreciate you taking time out of your very busy schedule to explain to us a little bit more about neurosurgery and the latest innovations that are happening with your field. So for those of you listening, and if you'd like to participate in the study, or if you just have additional questions or for Dr. Kenneth Rich, their office is located in Raleigh, and it's the name of their practice is Capital Neurosurgery. And he and his partner can be located at 919-850-9911. But it sounds like you have a wonderful staff, and y'all were just featured in MD News magazine, and they just go on and on talking about what a very friendly and laid-back atmosphere your staff has. So y'all won't get any voicemail problems. You get to talk to a real person if you call there.
We hope so.
Yeah, that's right. So this is Dr. Angela Ruff, and again, our guest this morning was Dr. Kenneth Rich. And again, thank you so much for letting us interview you.
Thank you for having me.
Yeah, you're welcome. And so this is News Talk 640 WFNC.